I'm Dr. Eric Shadle, and I'd like to ask you a question. What does it mean to be healthy? I mean, really healthy for you. Many of us may have different responses, and we might be frustrated by the fact that we're not as healthy as we'd like to be. In fact, when I look at the state of society's health in this country, we could all get pretty depressed as we see rising levels of heart disease and diabetes and overweight, and it just doesn't feel like there's anything that we can do about it. We spend over $4 trillion a year in this country on health care, and yet we have very little to show for it when we compare ourselves to countries that spend far less and have better outcomes. But it gets more interesting than that for me, because I'm wondering if we really think about what it means to be healthy, because we have bought into this idea that health is the lack of disease. Let me give you an example. As a physician, I've had the privilege of caring for patients who've had all manner of diseases. And one set of patients I find particularly interesting that in general we would say they're very unhealthy because they have cancer and they're actually dying from cancer. But I found many of these patients actually some of the healthiest people I could imagine when I think of their spirituality, I think of their relationships, I think of the purpose they have in life, and even their own testimony is that they are thankful, if you can believe this. There have been books written about this, that they are thankful for the cancer because it helped them understand life and thus their own health in ways that they could never have understood it before. Let's take my story, for example. At the age of 12, I decided I wanted to be a vegetarian. I somehow bought into this idea that a label could make me healthy. By label, I mean vegetarian. And yet, I didn't understand what a vegetarian diet that was healthy really was. I ate a lot of fried food, but it was vegetables. And so I found myself going through college and went to medical school and gaining more and more weight and getting into private practice. And then it was in 1998 that I was introduced to some scientifically sound information about nutrition and what a vegetarian diet, if I was to pursue it, or any diet, what it needed to be healthy. And so I really delved into that and I embraced it and I lost weight and I felt great and everything seemed to be going well. And now we fast forward from 1998 to 2012. Here I've been going along for years, teaching patients and community members how to prevent heart disease and diabetes and all of these things. And I find myself with chest pain. Yes, chest pain with vigorous exercise. Now I'm face to face with discovering what is that? I couldn't believe that it would actually be heart disease for the way I've been living and eating for all these years. But indeed, I did have heart disease. And I needed bypass surgery. 4 vessels needed to be bypassed. I was devastated. This was depressing. I wanted to give up. But instead, I went on a 1-year journey to determine exactly what might have caused this for me. And I realized that health is much greater than any diagnosis that we have. And our own genetic predisposition can really determine many aspects of our health journey. But I also found that there might be a few things for me that I just needed to adjust that would actually make my life much better and I could have a whole life. And that's when I then found this thing called Creation health. Creation Health, developed by Adventist Health Systems, is a holistic view of life and thus of health that integrates the mind, body, and spirit to allow us to achieve optimal health and to live life to the fullest. C is for choice, the choices that we make that impact our health. R is for rest, which is more than just a state of sleep, but a state of mind. E is for the environment in which we live that affects our health. A is for activity and how we need to stay active, but also how we treat other people. T is for trust, trusting ourselves and those around us in a way that gives us purpose and peace. I is for interpersonal relationships that we know intuitively are perhaps the most important aspects of our lives. O is for outlook that can change a life completely by how we view the world. And N is for nutrition that gives us the building blocks for health. From these Creation Health principles, I developed the Pathways to Health and Wellness seminar. I hope you sign up for this seminar today. Let me tell you a little bit about what this Pathways to Health and Wellness is. First of all, I use the word pathways very intentionally. It's plural because we each have our own path to take towards health. You have different genetics than I have. You have different desires and needs and issues than I have. And so what we do is not be prescriptive about what diet or exactly what you need to do, but give you principles. You know who you are, and you can take those principles and apply them in the areas that you see fit in the time that you want to do it. And during this seminar, we will give you a deeper understanding, facts that we find in the literature today about health principles. You know, we're all so confused about health because we can read the New York Times or we can read the Ladies' Home Journal, and every month there's something else that we're supposed to do. And sometimes this new principle directly contradicts what we thought we were supposed to do last month. But the fact remains that we actually agree in this country. The dietitians and the health experts agree on the basic principles, and that's what we'll be teaching you. Let me describe the overall structure of the Pathways to Health and Wellness. When you enroll in this program, the first thing that'll happen is that you'll go to a health screen. During this health screen, you'll get your blood pressure taken, your waist circumference taken, your weight measured. We'll calculate your BMI. We'll have you take a health risk assessment, just a questionnaire to determine what health risk you have. And after your health screen, you'll begin part one of 2 parts of the Pathways to Health and Wellness seminar. In part 1, we take 8 sessions in 6 weeks to really drill down on one letter of that creation acronym, and that's nutrition. We're going to talk about fats and what are good fats and bad fats. We'll talk about diabetes and what kind of dietary changes that you might want to take to control that or to prevent it. We will look at cholesterol. We'll look at heart disease and high blood pressure. So we're going to give you all of these principles that are based upon scientific evidence that you can incorporate into your life based upon the goals that you have for your own journey toward a healthier life. We then go into part 2. And in part 2, we start looking at the entire acronym. We'll spend 1 session on each acronym. That means there's 8 sessions in part 2. And we are going to help understand how each one of these letters impacts our nutrition and our overall health and life. There's one other aspect that I want to touch on here in part 2 that I think is absolutely vital. And that is a piece where we start looking at the choices that we make and why we make them. It's what happens up in our head. The thoughts that we have that may not be true, that we believe, that end up sabotaging the choices that we make. And so we're going to give you opportunity to learn how to do that and to truly take charge of your health. In addition, the last thing I want to talk about this structure is that health screen doesn't happen just at the beginning of part 1, but it happens again at the end of part 1 and at the end of part 2. That way you can start to see how your choices and your lifestyle changes are impacting your labs, and it'll just help you track the journey that you are on. Let's hear what some of our participants have said about Pathways to Health and Wellness.
Oh, I think it's very beneficial. I think you learn from the other people, and just the questions and the comments and just the information in general. I thought it was interesting how they showed like what the cholesterol does in your body and things like that. You know, they get down to a lot of details.
Some of the important things I did learn is just how unhealthy sugar is in terms of increasing inflammation, which leads to greater cardiovascular disease, and I never knew that connection, for example. I had an idea that saturated fats were bad for me, but I did not realize how bad.
I was impressed with the feeling of respect. He respects everyone and whatever journey they're on, whatever pathway they want to take, and it is about choice. And I like that he doesn't say, you have to do this, you have to do that. That's not worked in the past for me at all.
As a result of the Pathways program, I'm eating better because I am cooking better. And I'm sleeping better as a result of that.
My doctor suggested, that I had to change my lifestyle, and it was just a blessing that this happened. And I was able to get the information and change my diet, change my lifestyle. I mean, instead of, living to eat, I eat to live now. So it makes a big difference. I've lost almost 12 pounds. And, it's great. The knowledge that we get from this, the time alone is it's awesome, especially for, free.
The whole thing, it's so generous. To be given everything, to be given samples of food, to be given information, to laugh with people, and it's a fun thing to just come. And I found myself, and so did all the others at the table, looking forward to the times, we get to get together tonight.
I would say absolutely try it for 6 weeks. You'll be pleasantly surprised at the changes that you'll begin to make. And I think most importantly, it's a change of how you think about diet, about life, about your priorities. So I can't recommend the program highly enough.
I'm excited Centura Health is offering this program, the Pathways to Health and Wellness, at no cost to you. That means not only the labs are free of charge, but the experts that come in to answer your questions and give you more information, the cooking demonstrations and the recipes, and of course, the trainer that gives us the exercises and stretches that we can incorporate into our daily life. So I would encourage you to sign up. You can do that by talking with our local program director, or if you would rather just go to our website, go to www.coloradocreationhealth.com, pick out the program that is closest to you, or the one that maybe you want to go to with a friend, and sign up, and we'll see you soon.
Pathways to Health and Wellness is sponsored by Centura Health. For more information, go to coloradocreationhealth.com.